Welcome to Chapter 25, entitled Pharmaceutical Care, Health Promotion, and Disease Prevention. After discussing the exact nature of health promotion, disease prevention, and pharmacy practice, I argue that pharmaceutical care should not be separated from holistic approach to patient care. If pharmacists are going to contribute to healthcare and improving all health outcomes for patients, they need of course to focus on their area of expertise, medicines, but also on broader health and lifestyle issues. This gives them a role in health prevention and disease prevention. There are several practice examples where this has already been achieved. We will now address the question, what is health promotion? Like definitions of health, there are numerous definitions of health promotion. Health promotion may include a wide range of activities and interventions, including those that encourage individuals, families, communities or whole populations to adopt healthy lifestyles, encourage better access to health services and involvement in health decisions, seek to promote an environment where healthy choices are easy choices and educate people about their body and keeping healthy. Health promotion aims to maintain and enhance good health and prevent ill health. It has been argued that the overall goal of health promotion may be summed up as the balanced enhancement of physical, mental and social facets of positive health, coupled with the prevention of physical, mental and social ill health. The term encompasses a range of activities and issues including both individual and societal aspects. At one end of this range are government policy and legislation affecting health. These include actions with a direct influence on health, for example, legislation to ban tobacco smoking in public places, as well as those which affect the determinants of health, for example, social welfare and benefits policies. At the other end is an individual's lifestyle choices. The shift from infectious diseases to chronic long-term conditions has highlighted the role of lifestyle in disease causation, and therefore, the importance of prevention. One problem in examining pharmacists' health promotion activities is the lack of a single, stable, and bounded definition for each of the terms, ill health prevention, and health promotion. It should be noted that public health and health promotion are often used interchangeably in the literature on pharmacy, although traditionally public health has focused on populations rather than individuals. Next we will discuss disease prevention. A number of viewpoints is possible for preventing disease, with different terms. Primary prevention is concerned with preventing the onset of ill health and to detect high-risk groups. Activities are designed to reduce the instances of an illness in a population and thus to reduce, as far as possible, the risk of new cases appearing, and to reduce their duration. Examples include immunization, health education campaigns. Secondary prevention is about detecting a disease in its earliest stages, before symptoms appear, and intervening to slow or stop its progression. Activities include educating people about their medicines, education on healthy eating for people with diabetes mellitus, screening for and treating chlamydia. Tertiary prevention is about interventions designed to stop the progress of an established long-term condition, to control it and to reduce disability and increase quality of life. It seeks to change health-damaging behaviors and prevent the progression of ill health. Activities might include educating people with diabetes about diet and foot health, ensuring people with atrial fibrillation adhere to their treatment. Next we will discuss the uniqueness of pharmacy. Pharmacists are in a unique position in society. They are available for at least 8 and for up to 24 hours a day without an appointment. They regularly see the healthy as well as those with illness, and those living with long-term conditions. their position at the center of communities enables their premises to be used for health promotion campaigns which will reach a large number of people. The relationship that a pharmacist builds up with patients, customers, and their families over years. They have opportunities to promote health every day. Next, we will address the query: what is the evidence base for pharmacists' role in health promotion? A recent Public Health England commissioned review of pharmacy's role in improving the health of the public identified 20 relevant review papers. In the literature on the contribution of community pharmacy to public health is extensive and growing. A considerable body of evidence exists for the role of community pharmacy in a range of services, not only aimed at improving general health, but also at maintaining the health of those with existing disease. The evidence for positive outcomes is strongest in services including smoking cessation, emergency hormonal contraception, abbreviated as EHC, emergency hormonal contraception supply, cardiovascular disease prevention, blood pressure management, diabetes, and possibly asthma and heart failure. There was strong evidence of improvements in lipid levels that were sustained for at least 1 year in both primary and secondary prevention of coronary heart disease. Community pharmacists can make an important contribution to the management of people with diabetes for screening, improved adherence with medicines, and reduced blood glucose levels or HbA1c. Although published evidence is currently less strong in other areas such as chronic obstructive pulmonary disease, infection control, substance abuse, weight management, and minor ailments schemes, there are some reports of successes in the community pharmacy provision of these services. However, further research is required to justify the role of community pharmacy in these areas. This review did not identify any UK papers on immunisation and vaccination, although there is more recent evidence indicating that UK community pharmacists are providing services in this area. For example, vaccination is an established pharmacy service in several countries, the USA, Portugal, and Ireland, for example. And now let's address the query: how far should pharmacists' role in health promotion move? There has long been discussion about how far pharmacy's role in health promotion should move from their role as experts in medicines and providers of pharmaceutical care. It is easy to see a role in health promotion when it is linked to the sale or supply of medicines, like nicotine replacement therapy in smoking cessation, or advice about healthy eating or exercise to someone with a prescription for coronary heart disease medicines. However, should pharmacists provide brief interventions for problem drinkers or promote exercise classes when these activities are not linked to medicines? Should they provide health checks and offer health screening? Van Mill and Fernandez Limos asked if pharmaceutical care should always be associated with the existence of medicine treatment in a given patient, and by inference if we should therefore perhaps exclude educational activities or health promotion activities performed by pharmacists from the scope of the pharmaceutical care. They asked if other pharmacist activities that are not necessarily associated with medicines are parts of the concept, like smoking cessation programs, condom use promotion, needle exchange, or screening, and if they should be included as part of pharmaceutical care. In other words, is pharmaceutical care the care by the pharmacist, or care around pharmaceuticals? To understand these arguments, we need consider the patient for whom we are caring. Can we separate people's medicines-related outcomes from people's health outcomes? Do we offer a medicines-centered approach care or a more holistic approach to healthcare? If we narrowly focus on the medicines, will we miss key factors that will affect a person's treatment, recovery, and well-being? If we focus on an individual's health outcomes lifestyle, behaviors and well-being all become important parts of the treatment. We will now address the query, does pharmaceutical care link to health promotion? If we take the PCNE definition of pharmaceutical care at face value, it appears to be about the pharmacist's care of individuals to both optimize medicine's use and improve health outcomes. Pharmaceutical care is the pharmacist's contribution to the care of individuals in order to optimize medicine's use and improve health outcomes. It could be argued that those health outcomes are those linked directly to the medicines and not to broader lifestyle or well-being issues. Conversely, it could be argued that if health outcomes are included, then health promotion becomes inextricably linked to the pharmacist's or perhaps the pharmacy's role in medicine's optimization. The PCNE definition provides an approach that can easily include health promotion as well as medicine's optimization. Let's take a simple example. A 70-year-old male patient who is also a carer for his wife who has Alzheimer's disease, comes into the pharmacy for a review of their coronary heart disease medicines. The pharmacist carries out the review and ensures that they understand the medicines and how to take them correctly and that they are having the appropriate outcomes. She also asks him if they have had the flu vaccination this year. The pharmacist notices that the patient smells of smoke and has nicotine-stained teeth. She asks him how his wife is doing. If the pharmacist were only to concentrate on the medicines, the patient's smoking habit would be ignored, and so would his wife and the effect her illness might have on his health outcomes. Carers often neglect their own health, and are less likely to get flu immunizations. However, if the pharmacist broaches the subject of smoking and how it will affect the disease progression and treatment, and then offers support to help the patient to quit smoking as well as offering the flu immunization, it could be argued that more complete, holistic care had been offered, which will lead to better health outcomes. Next, we will discuss an English example of the link between pharmaceutical care and health promotion. In England, all community pharmacies provide healthy living advice to patients as part of the public health element of the community pharmacy contractual framework, and provision of relevant healthy living advice is also part of the Medicines Use Review, abbreviated as MUR, service, and the New Medicine Service, NMS. Medicines Use Reviews and the New Medicine Service are key medicines optimization services which all community pharmacist contractors in England are encouraged to offer to eligible patients to help them to ensure that they get the most benefit from their prescribed medicines. In the Medicines Use Review service specification, the pharmacist is expected to provide healthy living advice alongside advice and information about the patient's medicines in the following areas. A. Diet and nutrition. B. Smoking. C. Physical activity. D. Alcohol. E. Sexual health. F. Weight management. G. Other. Free text information can be entered in the clinical record. And H. Healthy living advice not applicable at this consultation. The majority of community pharmacies will also provide at least one locally commissioned public health service, such as provision of emergency contraception, stop smoking, or supervision of methadone and buprenorphine. The Healthy Living Pharmacy, abbreviated as HLP, framework provides a positive approach to focusing the whole pharmacy team and not just the pharmacist on promotion of healthy lifestyles and associated service delivery. The development of support staff skills and increased motivation to provide services has been a positive achievement of the HLP concept. The Department of Health, abbreviated as DH, introduced a quality payments scheme as part of the contractual framework in 2017. The following requirements must be met before a pharmacy can be registered as a Healthy Living Pharmacy Level 1. 1. The pharmacy has a consultation room which is compliant with the Advanced Services Standards and is appropriate for the services on offer. 2. In the past year, the pharmacy has participated in the provision of both medicines use reviews, abbreviated as MERS, and the New Medicine Service, abbreviated as NMS, and has proactively engaged in health-promoting conversations. 3. In the past year, the pharmacy has participated in the provision of the NHS Community Pharmacy Seasonal Influenza Vaccination Advanced Service or has actively referred patients to other NHS providers of vaccinations. 4. The pharmacy complies with the General Pharmaceutical Council's standards for registered premises and standards of conduct, ethics and performance. And 5. The pharmacy complies with the NHS Community Pharmacy Contractual Framework, abbreviated as CPCF, requirements. This illustrates that the provision of medicines-oriented services such as the Medicines Use Review are a prerequisite for Healthy Living Pharmacy Level 1 registration. We will now address the query, what approach should pharmacists take? Pharmacists have been criticized for being passive rather than opportunistic in their health-promoting role. Even though information in itself is unlikely to result in behavior change, it is an important part of attempts to persuade people to adopt healthy choices. There is now a body of evidence upon which to base efforts to change behavior. There is evidence that even the shortest of interventions can be effective providing they are delivered in a way that has been shown in research to work. We will now look at types of pharmacy intervention. Let's begin with a very brief intervention. A very brief intervention can take from 30s to a couple of minutes. It is mainly about giving people information, or directing them where to go for further help. It may also include other activities such as raising awareness of risks, or providing encouragement and support for change. It follows an ask, advise, assist structure. For example, very brief advice on smoking would involve recording the person's smoking status and advising them that stop smoking services offer effective help to quit. Then, depending on the person's response, they may be directed to these services for additional support. Brief intervention. A brief intervention involves oral discussion, negotiation or encouragement, with or without written or other support or follow-up. It may also involve a referral for further interventions, directing people to other options, or more intensive support. Brief interventions can be delivered by anyone who is trained in the necessary skills and knowledge. These interventions are often carried out when the opportunity arises, typically taking not more than a few minutes for basic advice. Next we will look at extended brief intervention. An extended brief intervention is similar in content to a brief intervention, but usually lasts more than 30 minutes and consists of an individually focused discussion. It can involve a single session or multiple brief sessions. Next we will discuss health promotion and pharmaceutical care in practice. Pharmacists wishing to integrate health-promoting activities into their pharmaceutical care need to adopt a style of consulting which involves listening and negotiating rather than telling, crucially taking into account the individual's social circumstances. This may involve the role of family members, carers or friends in the management of medicines, while taking into consideration living conditions, health status, and socio-economic resources. Pharmacists should adopt a holistic approach and think creatively about the opportunities to promote health whenever they are talking to patients about their medicines. By holistic, I mean addressing issues not traditionally associated with pharmacy or medicines, but which may actually be linked to the sale or supply of medicines or health-related goods. We will now look at a conclusion. In conclusion, It must be clear that pharmaceutical care cannot and should not be separated from holistic approach to patient care. If pharmacists are going to contribute to improving health outcomes for patients, they need of course to focus on their area of expertise, medicines, but also on broader health and lifestyle issues. Thank you.